Hi everyone, my name is Gayatri, and for the past couple of years, I've been helping to build Dimagi's chatbot portfolio. I want to start today by asking you a question. When you saw the title of the session and the word chatbots, what was the first thing that came to mind? Was it something like this simple menu-based chatbot, or did you think of words like AI and NLP? With the first kind on the left, chances are you've seen many of these. The picture on the left shows a chatbot with a simple menu of options that a user can choose from to learn more about each topic, everything from common symptoms of COVID-19 to which contraceptive method to use. On the other side are words that I hear us use increasingly when we talk about chatbots for public health, words like AI and NLP. And what we seem to want when we say these words is to make a chatbot that a user can just talk to, that a user can use to freely discuss their health concerns in any language of their choice, and that the chatbot will understand them fully and respond to them and help them figure out next steps, all automated with no human intervention involved. Which sounds great in theory. It definitely sounds a lot cooler than the simple menu based chatbot on the left. But I have to wonder, I live in India, and when I use a chatbot in a food delivery app to report an incorrect food order, the thing I'm talking to in English on this fancy app is not an automated chatbot. It's a person. So the chatbot of a highly valued global company with enormous tech resources today is not able to figure out that I ordered hummus instead of salsa without human intervention. And that too when I'm using the app in English, a language for which there are far more NLP options than there are for local languages in LMICs today. And if I think about that experience, I have to wonder, how realistic is it in the near term that I would be able to talk to an AI and NLP enabled chatbot about my health concerns and get its advice, especially if I did not speak English? I'm no Luddite, but I imagine it's going to take us a while to get there. In the meantime, though, I believe there is a lot of potential for using chatbots to enable behavior change. I just don't think we're going to get there by giving users simple menu based chatbots either, like the bot on the left. Here's my concern with menu based bots. With these bots, we're essentially giving a user a lot of information. And what we really want them to do is apply that information to a health behavior. Say a user reads about contraception on a chatbot and then goes and buys it and starts using it. But we know that just giving someone information isn't enough to trigger a change in their motivation or their habits. If it was, then paper pamphlets would have done the job already and there would be no behaviors left to change. So instead of the simple menu based chatbots on the left, or the bots that seem more futuristic, I would say, on the right, I want to advocate that as a sector, we spend more time on the bots that fall between these two extremes. And at the Maggie, we call this middle ground behavior change chatbots, chatbots that have the potential to drive improved health behaviors starting right now. And to explain what I mean by these behavior change chatbots, here are some of the key characteristics of these bots at the Maggie, both in terms of how we design them and how we implement them. The first is getting users to start talking to the chatbot. So building a chatbot is fairly easy to do today. But once you've built a chatbot, how do you get your target audience to know it exists? One approach is investing in building the capacity of frontline workers to onboard users. So for a chatbot called Nurse Lisa that we made with iPass's teams invested a lot of time in talking about Nurse Lisa to all their potential clients. And as a result, in just a few months, we had 3,000 plus sessions on the chatbot per month, and 12% of the users came back to talk to Nurse Lisa without any proactive reminders or nudges from us. Another approach is online advertising. In Rwanda, we recently launched Coachana, a chatbot that helps young women build financial literacy skills. And we made ads that we thought would appeal to our target users and ran those ads on Facebook. And in less than a week, we had 117 unique users who began talking to Coachana 180 times. Our second focus area is designing chatbots that users want to come back to. So one approach to driving user attention is through personas. Dimagi's first chatbot was called Poshan Didi, and for Poshan Didi, Dimagi invested lots of time in figuring out what the persona of Poshan Didi should look like, how her tone of voice should sound in her messages, and what would be the most relatable to her users. And the end result was a chatbot that had a persona so strong that users respected it and trusted it. And almost 50% of users returned to talk to Poshamiti in at least 5 distinct user sessions. Another mechanism for driving user attention is through engagement tactics. So with Coach Anna in Rwanda, instead of using a simple menu, we used an interactive quiz format that asked a user a set of questions like, is a lipstick a want or a need? And it was a conversational experience for users, more so than if we had given them a menu of options. And we could achieve that conversational experience here without AI and NLP. And we saw high retention rates. 28% returned to play the quiz twice, 10% returned to play the quiz 3 times. And at the end of the quiz, when we asked a user if they liked the content and wanted more of it, 88% of them said yes. And finally, we focus on evaluating whether a chatbot really does influence health behaviors. And there is a lot more work to do here. For example, with Coach Anna, I can see that users like to play a quiz and guess whether lipstick is a want or a need. But how do I know if that will change a user's behavior the next time she goes into a shop? One way of figuring that out is through in-person surveys. Another way is to embed questions within the chatbot to see how users' preferences change over time. And once we know how we're measuring the impact of a chatbot, we can start to study how cost-effective it might be to use one at scale. So as I wrap this up, I want to share a quote that we often say at Dimagi, which is that it's easy to build a chatbot, but it's hard to know what chatbot to build. And I'm sure that one day in the future, we'll have the cool AI and NLP chatbots that we want. In the meantime, at the Dimagi, we're focusing on figuring out this middle ground between infobots and AI bots, and figuring out how to make that middle ground as useful as possible for influencing health behaviors in LMICs. And we hope you'll join us. Thanks for watching.